So when the midbrain is overfiring, there are a multitude of symptoms that will begin to express themselves throughout the body. We can see light sensitivity, migraines, the heart races. You can have issues with constipation and diarrhea, chronic pain and fibromyalgia, urinary tract infections, insomnia, and fatigue. And we're going to take a look at each one of these and show you how an overfiring midbrain can cause each one of these symptoms. So the overfiring midbrain will have an effect on the oculomotor nerve, cranial nerve 3, which causes the pupil to stay open wider than it normally should. So now when you normally go out into a bright scene, or you go out where there's bright lights, or go out in bright sunshine, your pupil is supposed to constrict. But because this mesencephalon won't allow those muscles to constrict the iris, constrict the pupil, more light comes into the eye, which irritates the eye, causing the light sensitivity. An overfiring midbrain can cause the blood vessels in the brain to dilate. Well, those blood vessels have a nerve mesh that surrounds them, and when that blood vessel dilates, it irritates that nerve mesh, which then can cause the migraines. If we see that there's an overfiring midbrain, that means there is an underactive lower brainstem that's not firing properly. Well, the lower brainstem has an area called the nucleus tractus solitarius, which had the vagus nerve comes from, which the vagus nerve fires into the upper 2/3 of your digestive system. And so if that nerve is not firing properly due to this overfiring midbrain, it can affect transit time within the small intestine, large intestine, and colon, leading to either constipation or diarrhea. We also see the nucleus tractus solitarius inhibits urination, and so if it's overfiring or not working properly, urine will tend to stay in the bladder. So you'll go to the bathroom, you'll void, but you won't void all of the bladder, or you won't void all of the urine. And so the urine starts to collect within the bladder. That urine in that stasis becomes a great place for bacteria to grow. And so as the bacteria grows in the bladder, then now when you do urinate, you potentially give yourself a urinary tract infection. In the brainstem is an area called the reticular activating system, which basically controls our waking cycle and our sleeping cycle. Well, what ends up happening with this overfiring midbrain is when the reticular activating system is supposed to be firing at its highest rate at 3 p.m. in the afternoon, now it flip-flops. So it's firing highest at 3 in the morning and lowest at 3 in the afternoon. So when you're supposed to be sleeping, you start to wake up, and when you're supposed to be awake, you start falling asleep. The midbrain has effects that go to the spinal cord, especially to an area on the outside of the spinal cord called the intermediolateral cell nucleus, or the IML for short. This has distributions into the SA node and the AV node, which are what control heart rate and heart rhythm. So if you have a decreased right hemispheric condition where the right side of your brain is not firing like it should be, you can potentially see somebody's heart rate be faster than it should be. Also, if you have somebody that has a left hemisphericity or a decreased left brain, you can potentially see somebody with a heart arrhythmia. And so once again, if we exercise the weak side of the brain and get it stronger, we can fix these things that normally are not able to be fixed, potentially with drugs or surgery. We just have to fix the nervous system so that it works proper. That IML also fires into an area called the adrenal medulla. The adrenal medulla is a derivative of the adrenal glands. The adrenal glands sit on top of your kidneys. They secrete different hormones out into the blood, especially in response to stress. Well, these specific catecholamines and norepinephrine are released into the bloodstream by the IML, which then sensitizes type C nociceptive pain fibers. So now you become more sensitive to your pain receptors, and you feel pain a lot easier, which that leads to things as like chronic pain, fibromyalgia, and because of the chronic pain you're dealing with, the fatigue is a result of the fact that you can't sleep well because of the chronic pain. And once again, these are things that we can correct as long as we can find out which part of the brain isn't working properly and exercise the weak side. Emotional stress, physical stress, chemical stress, your brain really can't tell the difference. It just looks like stress. And so one of the responses to stress is for an area of the brain called the hypothalamus to release a releasing factor called corticotrophin. goes down the pituitary to release adrenocorticotropic hormone, which fires down into the adrenal medulla, which releases cortisol. Now, cortisol is very toxic to the brain over long periods of time, especially in an area of the brain called the hippocampus, which has lots of receptors for cortisol. Reason being is if we're under stress, like if a bear jumps out at us, we want to be able to remember that, so the next time a bear jumps out at us, we know what to do. So that's why we have all these cortisol receptors on the hippocampus. However, chronic exposure to high levels of cortisol will cause the hippocampus to degenerate, which then causes your ability to remember things to become less effective. Your ability to lay down new memories becomes less effective. You have trouble focusing and concentrating. And so those things are all a result of excess cortisol being released. It does damage your hippocampus, which causes this term that's been labeled as fibro fog, is the term that people have labeled this condition as. So how is brain-based therapy different? Of all the findings of the last 10-15 years, the biggest realization that's come about is this idea of neuroplasticity, where years before it was thought that after the age of 3 your brain was set in stone. There was no way it's going to be able to change. Now we know that's not true, and that through changing a person's environment, we can change the activation of their brain, and we can take a brain that is unbalanced and begin to balance it again, so that both sides are talking equally, sharing the workload, and being able to help the person function as a whole as opposed to parts. So when it comes to working up a patient, and we're trying to find out what can lead us to whether it's a right side dysfunction or left side dysfunction, we ask questions to health history that might point us in that direction. So asking about episodes of depression or anxiety can potentially tell us that they might have a left brain versus right brain issue, because people that have a left brain deficiency tend to have more issues with depression or anxiety, because the left side of the brain tends to be the happy side of the brain. So if it's not working well, we tend to have more issues with depression and anxiety. Difficulty scanning pages while reading, difficulty adding or subtracting, difficulty expressing what you want to say, difficulty understanding what others say to you. Those all tend to be left brain activations or left brain functions. Your reading, writing, and arithmetic tend to be all focused primarily on the left side of your brain. Your language centers on the left side of your brain. So if we see decreased access to those functions, we start thinking, oh, the left brain might not be working as well as it could be. Look at loss of sensation. That can be potentially either side of the brain. The health history, or I'm sorry, the evaluation helps us determine more so which side is the weak side. Changes in high handwriting, becoming more irritable or angry, problems with balance, tripping or dropping things. That once again can be either side of the brain. That's where the evaluation comes in to help us determine which side it is. And learning disabilities. People that have dyslexia tend to have left brain deficiencies. People that have ADD, ADHD, autism tend to have more right brain deficiencies. Then during our exam, we perform here a basic physical exam with extra tests involved, but the big thing that we're looking for with our neurological exam is symmetry, and to see not just if these areas are working, but how well are they working. So we check blood pressure bilaterally, we check pulse bilaterally, we check to see tissue oxygen saturation, both sides of the body. We'll check heart rate and heart rhythm, look at saliva pH, check reflexes, do eye tests, cranial nerve tests. If your doctor's not performing a cranial nerve test on you during your physical, you need to have one done. It's very important to find out how well your cranial nerves are working, because they're direct inputs right into the brain and gives us a great input, or a great window to see how well the brain's functioning. Then we do tests for balance and coordination, because we want to check that cerebellum, which is the back part of the brain, which if it's not working right, it's the biggest feedback into the front areas of our brain. So we want to make sure our cerebellum is working bilaterally, correctly, and as healthy as it can be.